So a patient comes in and they tell you, my neck is stuck, it's hurting, it's kind of off to the side. I don't know if I slept on it wrong or when I was cutting the lawn or I was doing something, and I don't know which muscle it is, but I'm having a hard time turning my neck, or it feels like it's stuck in some weird position. Well, how can we help make an assessment in determining which muscle it might be? Well, there's really 4 muscles that I'm going to look at, 4 main muscles that is probably going to be one of the issues, and we're going to want to palpate. But there's a quick test that I have to help determine the direction of the unilateral movement, because we're not going to go over bilateral movement. We're just going to go unilateral movement of these particular muscles, where their origins and insertions are, and how we can quickly identify it. So I use an acronym to do this. I have a can of Spam here. So I want you to think of a can of Spam, and then you scan it twice at the grocery store, and then you say, I love it. I know, it's just a emergency food. It was suggested, it's high energy, but I wouldn't eat this daily. But you use that acronym, SPAM, scan it twice, and love it, SSSL. So what does that stand for? The 4 muscles I'm going to look at is Spenius Capitus, which we know originates on the cervical processes of the neck, and then it inserts on the mastoid process of the temporal bone. So I like to use my hand as a knife, and I put it across like this, and I put my metacarpal phalangeal joint right here, this part of the thumb, and I put it on my chin, and I draw a line over to the mastoid process. Hope I'm not messing up my microphone sound. And then I simply start to contract, and I notice how it turns my head. It turns my head ipsilaterally, right? So ipsilateral rotation is what the Splenius Capitus does. Okay, so I'm looking at that direction. Now we're talking about, that was the Spam, so now we're looking at one of the scans, which would be the Sternocleidomastoid. And we know that it originates on the clavicle, the sternum, and then inserts on the mastoid. It makes it really easy. So again, I take that same metacarpal phalangeal joint of the thumb, and I place it like this on my manubrium of the sternum, and then I put my index finger as close to the mastoid process as I can. And then notice I can't turn my head into the hand. I can't do it. So when I contract my hand, it turns my head contralaterally, like this. So that's a real easy way to remember what the sternocleidomastoid does. It's a contralateral rotator. So we've seen an ipsilateral rotator and a contralateral rotator. They could both, one or the other could be one of the problems. Well, what would be the other scan? So we did the Spam scan. What's the other scan? Scalenes. These are really easy. They originate on ribs and they insert on the transverse processes of the cervicals. So I just take my thumb and I put it on the clavicle, and then I touch the mastoid process of the temporal bone, and I just pinch. Well, that's lateral flexion. That makes it really easy. Lateral flexion. That's all the scalenes basically do. Then we work on to loving it, which is Longissimus Capitus. Longissimus Capitus originates on the transverse processes of the cervicals, and it also inserts on the mastoid process. So what I do with that, this is really easy. It has 2 actions. It can rotate the head, and it can laterally flex the head. So it can do both unilaterally. I just grab my ear, and for longissimus, and I pull it towards my shoulder. That gives me the 2 actions, rotation along with lateral flexion. Just grab your ear and go down. So just as a quick review again, we got Splenius Capitis, ipsilateral rotation. We have sternocleidomastoid, contralateral rotation. Scalenes, we got lateral flexion, and then we pull the ear, we got longissimus, which is rotation with lateral flexion, when these muscles act unilaterally. And by looking at those muscles in that way, we can kind of discover where we need to palpate, where we need to stretch, loosen, bring fluid motion back to these muscles. We're probably going to find some trigger points along the way. and that way we can bring relief to our patients. So, and if you're in school and you're wanting to become a massage therapist, it's really easy to remember that there's 3 muscles that attach to the mastoid process: Longissimus, Spenius Capitis, and the Sternocleidomastoid. That really makes it easy for that. But those are the 4 muscles. I hope you enjoyed this tip. I hope it helps you to assess how to help your patients. And if you like this tip, please hit like and subscribe. And just remember this: if there's no discomfort on the table when you're working on your patients, well, it was nothing more than a foo-foo massage.